Hey guys, this is Michelle from Virtual Hand Care, and in this video, I'm going to show you how to tape for finger joint pain. So you can use this technique if you are having joint pain in your DIP joint or your PIP joint. Maybe you have pain in the joint because there's a little bit of arthritis, or maybe you had a fracture or finger surgery and you're noticing a lot of tightness, maybe limited range of motion or pain with your range of motion. This technique can definitely help for that. Now keep in mind there's many different types of taping techniques. So you can use this technique for a possible rotation happening at that finger joint, and that's why you're feeling some pain. What we're going to do is try to correct that rotation, and in the finger joints, it's ever so slightly, but just a tiny bit of correction can make a world of difference on how your finger joint feels. So you're gonna wanna get yourself some muscle aid tape, kinesio tape, K-tape, any kind of skin-friendly tape. You could maybe try to use a Band-Aid too if you wanted to just try it real quick before you bought a whole roll of tape. Go ahead and use a Band-Aid, see if you notice a little bit of a difference, and if you do, then you're gonna wanna get yourself some tape. Okay, we're gonna need just a tiny piece of tape because our fingers are not big. We don't need to use a really big piece. So you're gonna wanna cut yourself about 1/2 inch to 3/4 of an inch. And then you wanna take that small piece and then you wanna cut that in half. And then you're gonna wanna cut that in half again. And now you have 2 little pieces of tape. Say my DIP joint is the painful joint, or maybe it hurts, when it gets pushed to the side a little bit or when you're trying to flex. So this particular method, what we're gonna do is you're gonna tear a little bit of the backing off the tape and then pull that off. Then you're gonna go ahead and place the tape on the nail. And then you want to apply a little bit of a stretch along the side of the finger. So say it's a little sore on this side, or when I bend, I feel it more on this side. We're going to go ahead and apply a little bit of tension on the side of the finger. And then you're going to go ahead and remove the rest of the tape and then just kind of lightly lay that piece down. And it's okay to have that piece be a little bit at an angle, and it's okay to have a little space. You don't want to compromise the blood flow, the circulation to the fingertip. So then you're gonna take that second piece of tape and do the same thing, except this time we're gonna start that first piece this way, because now we are gonna pull and stretch in the opposite direction. So then what we want to do is take the rest of that off, and so then we want our stretch to be on the side of the finger, and then just lay that down on that side. So to recap, we have a stretch going this direction, and then on this one we have a stretch going in this direction. And then what you want to do is test that out. So you want to lightly move that DIP joint, kind of bend it, move it around, see if you notice a little bit of difference. If you don't quite notice a big difference, you might need to play around with the position of the tape, the starting point. For instance, you might want to take this lower one and start more on the top and go around on the other side of the finger. Keep in mind the direction of pull is gonna be different for each of you. And so you're gonna have to kind of play around with that to see what is right for your finger. If you have PIP joint pain or pain down in the lower joint, then you would just do the same thing. You would then apply a piece of tape below the PIP joint in the opposite direction as the one right above it. Now, as you can see, you can play around with the type of rotation, you can play around with the thickness of the tape, you can play around with angles and your starting point and wrapping around the finger. Again, keep in mind, you don't want to wrap all the way around your finger. You don't want to compromise the blood flow, the circulation to the fingertip. So always make sure you have some kind of a gap and that the pieces of tape don't meet. If you found this video helpful, do please give it a like and hit that subscribe button below, and check out these videos here that YouTube is suggesting for you. Thanks for watching.